I'm Kim Scott. I'm the Chief Executive Officer of Trillium Family Services in Portland, Oregon. Trillium Family Services is Oregon's largest provider of behavioral health services for children and families in the state of Oregon. We're located with offices in Portland, Oregon, in Corvallis, Oregon, Salem, Oregon. We provide services ranging from the more intensive, which would include alternatives to what used to be a state hospital setting, alternatives to inpatient hospitalization, a variety of psychiatric residential services, and a very robust community program that includes a outpatient model where we're moving into schools and really creating wellness centers in schools. So we're in about 60 schools in the Portland area. We offer the same types of services in Corvallis. We're in about 20 schools. So we have a wide range of services for children and families. What brought me into this field of work was that as a youth, I would probably be considered somewhat of a troubled youth in my own way. Came from a family, I think, that really suffered from being in poverty. And I think that early on I understood the impact that other people can have in a helping way. Certainly some leaders in the community were able to invest in me and help me. I think I grew up with this idea that I wanted to be there for kids and families. So at a fairly early age, I was a junior in college, 20 years of age. I started as a residential child care worker at Waverly Children's Home, and I've done a variety of jobs from being a program director at a youth corrections facility in Juneau, Alaska, to being Trillium's first chief operating officer, and then in 2004 becoming the chief executive officer for Trillium Family Services. And once I got connected with kind of that magic of what it means to work with people and be in the helping profession, that passion for that has stayed with me all of these years. When I first came into the field, I was very focused on I wanted to come here, I wanted to change the world. I wanted to make things better for kids and families. One thing for me that I think that really stands out that has helped me throughout my career is this concept of, is there love in your work? I mean, one thing is I may love my job and I may love my work, but when I think the passion that a leader needs to bring in this field, they really have to understand that there is love in their work. It goes back to that kind of when I think about the definition for the word philanthropy, it means for the love of mankind. And I think over the years, I probably decided along the way that what was really important was the transactional aspects of the organization, making sure that we were financially strong, making sure that we were the best organization in terms of quality. And I think now, if I think about it, I'm more inclined to think that what's truly important is, are we moving the needle on social change? It's not just about Trillium Family Services as an organizational entity. It's more about really doing the work we wanted to do in the first place, which is to create social impact. My thinking about the characteristics of a leader in this field has probably changed somewhat over the years. I think when I first came into this field, like a lot of us, I came in with this idea of I was going to change the world. And I think there's something about the work that we do that over time, that passion in some ways almost gets drummed out of us in terms of the realities of either how complex the world is, or the systems that we work within, or the regulatory environments, or the funding. And I think over time that leaders can get focused on those things and they lose sight of really the joy that brought us, the potential for joy that brought us to this work in the first place. And that joy being we could actually create social impact and change. I think in this industry, as not-for-profit organizations who are really focused on providing life-saving services or community-changing services, strong social impact kind of services, we can lose our way on that path. Our intentions can really become diverted. And I think there's a lot of things that drive that. Everything from our financial wherewithal or status, how effective we are there. It's a complex industry with a lot of regulatory environments. The people that we provide services to come to us with a lot of complex clinical issues, or there are things that have happened that make the work sometimes difficult. From my experience, we can start to focus on things that are more transactional in nature. We can focus on metrics, on finances, on those things are important. But if I look at it, for me, the most important thing is how do we move an organization forward to being more transformative and connecting what we do with real social need. So for me, it's been this kind of an up and down type of phenomenon where I came in thinking I could change the world, got very clear that I couldn't, became really transactional, and now I'm at this place where I do understand that one person, one organization, one community can have a huge impact in terms of how our world looks. In 2004, I became the CEO for Trillium Family Services, and it was a very complex time, a very difficult first year. One of our programs was unionized, and so right off the bat in my role, one of the first things that was a challenge for me was that the union contract was up, and we became embroiled in a very difficult conversation where what the union felt like it needed economically and what we felt we could provide economically, there was a very broad gap there. And so that resulted in a strike. So we had employees on the strike line. There was a huge systems change in Oregon at the time called the Children's Change Initiative, which moved us from directly contracting with the state on this very predictable financial model where contracts and payments were essentially guaranteed on a 1/12 basis to a model that was a fee-for-service managed care model. Where consumers had choice, where there were localized purchase options for services, where in a fee-for-service world, you're only getting paid for, is active treatment happening? Is effective treatment happening? And in 1 year, the organization lost $7 million. It was a $20 million budget. We lost $7 million. That's something that we couldn't fundraise our way out of. So we certainly had to focus on, how do we survive at that point as an organization? And so for me, what that meant, my leadership change was kind of moving from this kind of a person that was somewhat gregarious and connected with others to a leader that started to focus more on this kind of command and control, top-down. I think I was bearing that responsibility of I have to make these decisions. And maybe I did. I think it was an important time for somebody to make some hard decisions. I went to my board and I asked the board to hold me accountable to three things. The three things were, we need to live. I asked them to hold me accountable to having the organization live within the contracts that we have, to fund depreciation within our business model, and thirdly, that we would use fundraising rather than subsidizing programs, that we would use fundraising really to invest in innovation. What did work undeniably was the fact that during this 3-year period that we did turn the organization around financially. In essence, by as I stated in 2007, we had lost about $7 million at net operations. By 2010, with all of the moves that we made, all the decisions that we made, we were able to generate about $3 million from operations. So in a fairly rapid pace, we were able to financially turn the organization around. But there were also costs attendant to that. As I referenced earlier, the kind of process that we went through really started to hamper, curtail, starve the organization in some real core areas. And I think where that became most evident for me was in 2011, May 26, 2011, there was a suicide in one of our residential programs. A young woman, 15 years of age, a youth. And for me, that was a very clear point, a very clear indication that we had starved the organization in terms of training. And what I realized is that the staff that was working in our organization was that they had become disenfranchised and disengaged. And I saw that as a direct result of some of that financial gain that we had made, but that in that process of focusing on those transactional elements, gaining this financial high ground, that along the way we lost a lot as it related to connecting, engaging, and being in relationship in the right way with our staff and our organization. Going through that kind of a crisis made me more deeply appreciate what precious resources these services are, particularly if they're connected and embedded with communities, and the importance of those. So as a leader, I've always heard that you shouldn't take yourself too seriously. And I like to have fun in the workplace. I like to be gregarious. I like to connect with people. But I also realize in a way of providing effective leadership that you do take yourself seriously. What you say, how you act, has a huge impact on an organization and those around you. So if I were to go through that all again, I think I would approach it less from this command and control perspective, and to take a look at it and say, there's a way through this, in an authentic way, there's a way through this that is better. You and I together, figuring out a solution, is far better than what either one of us could come up with separately. So I think one of the learnings about this is that from a constructionist perspective, what we say as leaders, what we do as leaders does matter, and it's really, really important. And so I think that as I'm moving forward in the work that I do, I think that I have found my voice around why we're here and why we do what we do, and that I try to be intentional about that. In 2004, our focus on organizational survival was so intense that really did lead us off our intentional pathway of being a mission-driven organization. And I think part of what I mean by that is obviously that there was this focus on survival and the fear that I talked about of things going awry on my watch. But the other part of that is structurally, as not-for-profits, I think we're unfortunately in this trend where many of us talk about our organizations in terms of programs and services, size of budgets, numbers of donors. And in that process, and looking at all those internal metrics, which are important, those are things that keep us insular and keep us focused on the internal workings of an organization. And there's a place for that, but it's that thing about I can't see the forest because of all of these trees. The truth of the matter is we're here to drive social impact, social change, and the community around us should be stronger because we're part of it. And there's a danger in focusing on those other transactional things at the expense of what we were really trying to do in the first place. I think unintended consequences of the changes and the turnaround that we went through was that with that kind of top-down decision making, we're gonna survive this. I think we lost to a degree that passion that people have for being truly part of an organization where they're part of the decisions, they're helping move the organization forward. I think in some ways when you're focused on survival or these internal types of metrics and issues, you start to lose some passion, innovation, creativity. Staff really are here. People really do want to change the lives of children and families. And if all you're focused on is cash in the door, accounts receivables, those kinds of elements, you're really not going to bring the organization along in a way that you would hope to, and you're really going to lose. You're going to lose the horsepower, the capacity that you can get from engaged people who really want to make a difference in the lives of children and families. So I think in this whole process, organizationally, we went through what we went through, and it became very clear to me that the organization had to change. And then probably in a moment of clarity, I realized that the organization wasn't going to change unless I changed. And so in this process of being in a crisis, I think what grew out of this was this feeling that I had that the organization's survival or success was going to rest with me, and that I needed to make these decisions. I would be accountable for those decisions, and maybe for a period of time that was important because we really did have to make decisions that were about our survival, and I get that. But we stayed in that place for a long time. And it took a tragedy pretty much for me to understand that I had stayed there too long, and with me staying there, that meant that other people weren't sharing in where the organization was headed. They weren't sharing that. They really weren't engaged in it at the level that they should have been. And in fact, I was insulating them from that engagement because I had become so focused on driving the organization. Going through the change that we went through, it's hard for me to separate what the organization needed to do in terms of change without really looking at myself and my role and how I needed to change. I think in the midst of the crisis, the financial crisis, I got really focused on being the person that really needed to make the decisions, come up with the solutions, because I felt accountable. I really felt like this was a time that I needed to do this, and maybe even the survival or the success of the organization depended on me. And maybe there was a short period of time where decisions needed to be made that really I had the authority and the responsibility to make, but I probably stayed there too long and probably took too long to connect with others, to talk about not just my vulnerability or Trillium's vulnerability, but start to take a look at this in terms of the system that we were in, and to just identify that, we weren't the only ones in crisis. There may have, through this process, had I reached out and connected more with others, probably found some kindred spirits that were also experiencing some of the things that we were experiencing. And I think that one of the real dangers here is just becoming insular and focused on your own situation and your own problems. So I think a real learning from me is, I think, around engaging, connecting with others, being open to learning, understanding narrative, understanding our story, comparing that to other people, and really just trying to understand and learn from the situation that you're in. In this process of moving from an organization that's just seeing itself as a compilation of programs and services and the delivery of that and how well we're doing it, is that you really do have to be part of community. I think one of the core questions is the community around us stronger because we're part of it? I think that you start to have to, as a leader in an organization, be open to community engagement, and be open to learning, and be open to understanding that you don't know everything. And in fact, you can't know everything if you're not connected to the people who live in your community. So for us, I think one of the things that started to happen was that understanding of that we had been operating in isolation, and we realized that we needed to become a convener. We needed to invite people into conversations that we might not have the answers in terms of the problems that we were talking about. So these became shared conversations and gave us an opportunity to be a catalyst. I think for me, that has driven and will continue to drive our community engagement, this authentic process, understanding that we can do more together than we ever could apart. But I think you have to be authentic about that. I think that you can't come into it with this preconceived notions, ideas of this is how it has to be. With that, I think you have to know who you are as an organization. And if I go back and I think about all those times that we were struggling with environmental risk and the issues that we went through, I don't think that we had really identified who we were. I feel like, if I think about it like a house, I feel that we had the framing and we had all this talent in the organization and evidence-based practices. We really didn't have a foundation. We didn't have that, who do we want to be? How are we going to be in community in Oregon with people? And I think for us, we really decided that in order to do that, we needed to find something that would give us that grounding. And for us, that has been trauma-informed care and the sanctuary model. Thinking about how we engage change as organizations, I think that too many times we've been reactive to change. Something happens, there's a tragedy, there's an event, and we then try to get the alignment that we need to get through that, whatever that situation is. And what I've begun to realize is that it's not just being proactive, but we need to embed in the DNA of the organization the ability to embrace change, disequilibrium, and to really commit to being adaptable organizations. And I think that you can't do that. You can't be adaptable unless you really have the context of the organization within the community. It just can't be the organization by itself. So if I think about adaptability, we know we live in a complex world where society is changing rapidly. The needs of people in our community are probably becoming, they're changing, but they're also becoming greater. And so we have to be adaptable just to keep pace with the needs of the people that we're trying to serve in the first place. So if I think about the need for, how important it is for leaders to be adaptable, is that first off, if we're not adaptable, open to change, open to new learnings, and really staying connected with, where is society headed, then we're not going to get the alignment that we need with our organization so that our organization can also adapt accordingly. And if you think about, it gets overused, but the Gandhi quote, be the change that you envision. If you as a leader are stuck and are really not open to learning and adapting, then your organization most likely is not going to be able to do that either. So if I think about that, you can be stuck at a time when the world is really moving forward. If you think about healthcare transformation and integration and how people are thinking about whole person, whole health, population health, if we're just stuck thinking about our programs and our services in isolation, we're really going to miss the boat. We're not going to be part of what could be a watershed moment in the history of this country. So those are the kinds of things from a leadership perspective, is how do you become part of that process where there is really important transformation, good things happening for our country, and how do we be part of that? If we're not adaptive and we're stuck, we will miss out on it. Trillium, back in 2004, 2005, when we went through all that we went through, if we simply would have stayed where we were, saying we know how to do this, we run the best services in the state, we probably wouldn't be here. And in fact, there's a lot of evidence, the other organizations that went through the same thing that we did, some are no longer here because of the fact that they weren't able to adapt. So adaptability is important in terms of the people and the communities that we serve, and it's also important that in order for the organization to be all that can be, we have to be adaptable. There's Open Minds as a national website that works in this behavioral health space. One of the writers there, Monica Oss, talking about are not-for-profit organizations, are we really driven by mission, or is mission an anchor around our neck? I love the way that she illustrated it. She talked about in the communications industry, if you think about this, who fared better? Organizations, businesses that focused on making the globe smaller through effective communication and technology, or organizations that focused on building the next best payphone? And I think sometimes, we focus on building the next best payphone. We're going to make the best residential program or outpatient program. That's only good if it's in the context of what does our community need. When you think about organizational change, personal change, doing things differently, adapting, there is some loss. I mean, there's some loss of, well, I've always done it that way. That feels comfortable to me. That's very familiar. And my experience with that is that loss, that we need to attend to it, we need to kind of feel it and own it. But I also think that it can be short-lived. What I begin to learn through some of the work that we've done in trauma-informed care is that this whole idea of change is really about creating safety, safety for yourself, safety for the organization, others that are involved in the change. But adaptive work by nature means that we are effectively dealing with loss, and that loss is part of the change process. But if we can go through and we can envision what the future looks like, and kind of get excited about that piece. If we're talking about our loss, we're owning it, we're experiencing it, but we're really focused on, but here's what the future is going to look by the change that we're creating. I think that creates this alignment and a roadmap that can navigate that loss so that we're not stuck there. And that's been my experiences, is that with opening the organization to possibilities around what can happen in our community, yeah, I have to change, but when compared to where we can get and what can happen in our community, it really pales. In bringing, not just creating change with myself and thinking about how to lead the organization, alignment is so critical in the work that we do. And I really needed a structure that galvanized our best collective efforts and thinking. And so for us, that became the sanctuary model, which is a trauma-informed care model that takes into account how trauma affects individuals, systems, organizations, families, communities. And I think that just that basic tenet of one of the things about trauma is that it's all about creating safety. How do we create safe environments organizationally in our community? And if you think about change, so much of that is about safety, personal safety, organizational safety. It's disruptive. And I think that trauma-informed care helped give us the skills and the tools to constructively think about how to create safe environments. In Sanctuary, it talks about kind of 4 domains of safety. It talks about the need for, obviously, physical safety, emotional safety, social safety, and moral safety. And I think thinking about those domains, the commitments of Sanctuary that include, there are 7 commitments of Sanctuary. It's growth and change, open communication, democracy, nonviolence, emotional intelligence, social learning, social responsibility. Those structures and then the tools of the model, I think helped serve as a compass for probably everybody that works in the organization, not just presently, but also into the future. How are we doing? There's probably a day that doesn't go by where I don't think about interactions that I've had or meetings that I've been in where I've looked at those 7 commitments and thought, I wonder how I did on emotional intelligence during that meeting. Or, gosh, I wonder did I create a safe environment in that meeting or in that interaction? And we're putting that into all of our organizational practice. It's a way of being. And so I think that moving forward, that alignment, that sense of having a foundation, kind of that speaking as one person in the organization. I mean, it's just like the organization has holistically adopted this. I don't think I'll ever have to go back to thinking about this all being on my shoulders, because it's built into the DNA that our organization, we're in this together and we're connected with others. I think with the kind of change that we've gone through and how all of that started, if I were to think about how I might do that differently or how it played out, the way that it played out was that, given the crisis that we had, I was very clear that something needed to change, and for me personally, I did a lot of the study and the research on trauma-informed care and brought that to the organization as a as a possibility, as a way to start navigating this. And I think if I were to change anything about that, is that I think I would start at the beginning to start to think about how do I build a critical mass of people that could really get their hands around the dynamics of change, the need to change, why we're changing, all within that context of we're doing all this change to better meet society's needs. But I would hope that I would be able to be more inclusive internally. I would also hope, and I think what I've learned from my community engagement, that I would have reached out to more members in the community to share my thinking and share my understanding of where Trillium was, where it needed to be, and to bring in some people to help, stakeholders to help support that process moving forward. Now, I didn't do that in the beginning this time, but what I think has happened because of the work that we're doing, I don't think I'll go back to that point where in isolation, independently, I'm making these decisions, because now it's built into the structure of the organization. We have these processes in place. We're focused on inclusion, participation, change management together, and not in isolation as an organization, but connected with the broader community. So I feel like, yes, I started out thinking about this kind of by myself in isolation. I don't think I'll ever have to do that again, given what we've structured. We introduced Sanctuary to the organization and this concept of trauma-informed care and organizational, being adaptive organizationally. A lot of that came from our experience, the crisis, and as I mentioned earlier, the need for me to make personal changes as a leader. And so when we began to implement this, a lot of it again came from me as the leader putting this forward to the organization. I then engaged the board, I engaged our constituents, I engaged our leadership in a conversation about that. I think if I were to do it differently in the future, I would probably at the front end of it be more open to not just getting that organizational alignment internally, but reaching out to our community. I mean, now that's just part of what we do. We do community forums. We see ourselves as a catalyst on key societal and community issues. I would have engaged them at the front end of our journey of what does it mean to be trauma-informed care and creating a sanctuary organization. Having said that, we're only a year and a half into that process, and already we've started to engage the community in not just an organizing, not just sanctuary as an organizing principle for Trillium Family Services, but with those 7 commitments and the safety domains that I mentioned earlier. We're seeing this as an opportunity to create a social movement. We're going to use those. Anybody can follow those 7 commitments. You could be the Bank of America. You could be, we talked to somebody recently who does this work, and they actually even worked with a winery who's thinking about how to implement sanctuary. So I think that there's an opportunity to look at this as a social movement. I also wonder, going back to that idea of thinking as us as organizations, oftentimes only thinking of programs and services, maybe that's one of the keys that we need to think about, that yes, we provide programs and services, but what we're really trying to do is create a social movement that leads to better lives for children and families in this country. So earlier we talked about systems change, organizational change, personal change, and how do you keep that fresh and how do you keep the excitement moving forward? And for me, I think one of the gifts that I think about that we have as leaders is we get to tell the story about our organization. We get to create a narrative through our leadership, through our connection with our staff, with our community. From a constructionist perspective, people will tell you that what we think about, the stories that we tell, the narratives that we create, create the reality around us, and in fact we're creating a desired future, which I think is really exciting. If I think back to the crisis that we had and how we got out of that, we very clearly stated a desired future in those three things that I mentioned. We talked about that we would live within our contracts. We talked about funding depreciation of our facilities, and we talked about using fundraising strategically. And 3 years later, we went from an organization that had lost about $7 million in 1 year to an organization that had actually generated $3 million in surplus 3 years later. And that happened because we very clearly created that narrative, got the alignment in the organization. What I'm excited about now is that narrative is different. That narrative about is how do we create a stronger community, a better society? How do we deal with these really complex issues? And we get to create the narrative. We get to identify the possibilities and work towards that and creating a better world. To me, that's very exciting. So, how do you keep engaged in this change, and how you stay, I think, energized by it all? Again, going back to what is the narrative that we're creating. So as a leader, if I'm focused on all of the problems of the system, I could create a narrative that says this is overwhelming, we can't do this, but that's not going to work, because if we create that narrative, that's exactly what will happen. Is nothing will happen. I get really energized when I start thinking about every social movement that I've seen that has really taken hold in this comprehensive kind of world-changing way. It's because someone somewhere was able to paint this picture of a different future. And to be very clear about what the outcomes would be. Think about Dr. Martin Luther King. He didn't start that speech that launched the civil rights movement with, "I have a problem." He started with, "I have a dream," and then he articulated the vision for that. And the beauty of that "I have a dream" speech is that it's inspirational, it's aspirational, and it's that compass that can keep us grounded when we know that we're falling astray away from that path. But for me, that's an exciting way to keep people engaged, knowing what that vision is, working towards it. But it also puts the responsibility on us as leaders of organizations. If we're leading with this deficit story of we can't do this and we can't do that, and that's the narrative that we're creating, then that's also the tone that we're setting for others in the organization to follow, versus we're going to move the needle on social change. We are going to deal with these complex issues in collaboration and partnerships with others, and we can do it. That also creates a different narrative and engagement in the organization. That's a way to get not just yourself excited about change, but to get the organization aligned and connected with that enthusiasm, excitement about the possibilities. If you look at the change over the next 5 years that we can anticipate, the one thing that we do know is that change will be there. And I would always go back to that piece around, as leaders, are we walking the walk? Are we being the change that we envision? Are we embracing the need for change? And then organizationally, are we serious about investing and building capacity that will help us navigate and kind of engineer the change that we want to see? What I would say about that is that we have created resources that we didn't have a few years ago. We now have a chief strategy officer. We have an office of project management. We have a chief communications officer. These are all things that will help us advance the organization, our ability to manage change. The other thing I would say about that is that as long as we're doing what we need to do in connection with community, the needs of children and families are going to continue to evolve, and we need to be there with them in that process. If comprehensively across the United States, we took on more of a trauma-informed approach, a community action approach, a working within community rather than upon community, and we looked at social impact rather than just programs and services, I think our world would look decidedly different in terms of what our schools look like, that would have an impact on not only the quality of education, but the safety of our schools. It would have an impact on poverty in our community. I think it would have an impact on our daily lives, the stress that we all have to manage each and every day, either in family, at work, just in our daily lives. I really think that we could change the dialogue around this deficit-based world that we live in into really pursuing possibilities that have a return on investment and impact. I think change leadership matters because we've said so many times already that the world is changing. There's this thing that is called reality that will be driving change constantly. So organizationally, how do we better support people in being able to make the changes that they need to make personally and the organization needs to make so that we can best serve those that we're supposed to provide services to. So it matters in terms of these precious resources staying connected with the world in a real way that is relevant in terms of that change and those needs. Like our vision says, in a way where all children and all families are safe and have the opportunity for success. So, this isn't about change for change's sake. I mean, there has to be a kind of a pathway and some core values and a vision, obviously. Organizations really need to know themselves. They need to know what their core values are. They need to be connected in their communities, as I've referenced. That whole concept of our core values, organizing principles, the kind of social movement that we want to see. If I referenced earlier the 7 commitments of sanctuary. Those commitments for us serve as a compass that keep us grounded in a daily way, in a long-term way too, to say, are we on the right path? Are we, how are we in relationship with things like emotional intelligence, social learning, social responsibility? But if our relationships in community are truly authentic and we're connected with all people in our community, that relationship is also going to inform us as if we're right on and we're headed where we need to be headed. And I believe if we're authentic in that, then really we need to be responsive. We need to attend to the needs of the community. So all of those things coming together, I think, are a blueprint and a compass to keep us moving in the right direction. As the organization is changing, I continue to change. And what I've found is that because of the connection that I have with community, it's easier to change. I know the gaps that I have in terms of my own personal being, my skill sets, and I tend to seek out people that push me in new ways. In the past year, I've engaged a coach that's helping me in the area of equity, inclusion, undoing racism, because I felt like that was an area that I wanted to be pushed in, that I wanted to learn more about, that I needed to feel uncomfortable because things are not where they need to be. So from my perspective, this engagement again externally with new partners, with new voices, with all kinds of people has made a profound difference in me as an individual, but also the organization. This work still matters because it's such an opportune time. If I think about systems and the work that we've done with kids and families and vulnerable population, over the years it's been so fragmented, it's been so siloed, and if healthcare transformation has done anything, it's brought us to this point where there are more universal conversations from all kinds of practitioners about how to make things better in terms of health and wellness. We have the physical health service side talking with the behavioral health side. We have folks talking with people that are working in poverty, that are focused on social determinants such as education, homelessness, access. We're all talking together now. And that's new. That is a process that's not always been in place. And that has import for the collaborations that we have, the kinds of partnerships that we have. It's changed how we think about partnerships. In the past, I have often thought about partnerships with organizations that were similar to what we do. I no longer think that way because I think that's too vertical. Now I think about we can partner with universities, we can partner with hospitals, we can partner with homeless programs, we can partner with poverty programs. That idea of coming together in a really strong horizontal collaboration that can move the needle of social change. I would hope in terms of if I look back at my career and the takeaways are, there's a way to learn from everything that we do. The successes that we have can certainly ground us in thinking more about what we had the success, what are the possibilities. We can also learn very much from our failures, and that those failures sometimes are even better teachers in terms of what we need to do differently in the future. And I think the other thing for me is that in this industry, that there is oftentimes a reticence, we're hesitant about innovation and risk. A lot of that I think has to do with funding, but that can be this overriding excuse if we're not careful. I think that we do need to focus more on our learnings, innovate more, take more risk, and if we fail along the way, we need to be able to make sure that we have systems in place that help us learn from that. I think my advice for leaders coming into this work is that first off, really care deeply and passionately about the work that you do. Secondly, take yourself seriously, but not too seriously. Have fun. But the serious piece is, again, understanding that when you take a leadership role on, you are becoming the voice, a strong voice in your community for the needs of children and families and our most vulnerable citizens, and that's such an important role and responsibility. I think that you need to be courageous in terms of giving voice to certain truths. Everything from making sure, as a leader, you have to make sure that funding is adequate. You have to make sure that funding then ties to the right services, to the right people, that you're getting those services to them in a timely, responsive way. Also, voicing truths in areas such as, in topics such as violence, social injustice, equity, lack of equity, those types of things are going to be really critical. And last of all, love what you do. When it's all said and done, I really love the work that I do.